She goes on to say social and occupational impairment. And that's all the VA raters really care about when determining your rating. Actually, the rater determines the rating, but the CNP examiner gives the info to the rater. So, social and occupational impairment. If you're new around here, this might be a new phrase for you. Also, if you're new around here, be sure to subscribe to the channel and click the like button on this video so you don't miss any of my upcoming videos. So social and occupational impairment. Here's an example. She had a female who had a hysterectomy and she claimed it, and it was on her disability claim. She went to a CNP exam for it, and she was baffled as to why she only received 0% because it occurred on active duty. The reason why is she had no symptoms with the hysterectomy at all since it happened. It made her previous pain go away. She had no impairment whatsoever, despite having an operation. So I thought this was a good example. Had a problem, hysterectomy, right? Had surgery, had it taken care of, and then there's no complaints. The problem solved. Hearing loss is another one that's kind of like this. Your ears get blown out, and you go to the audiologist, get a hearing test, and then you're 25 years old and they stuff hearing aids in your ears. No more problem. You hear fine, veteran. So it's like that. So social and occupational impairment, how it affects your work and your social life. You need to get familiar with this. And if you are familiar with it, you can't get too familiar with it. I learn it almost on a daily basis. She goes on to talk about flat feet, pes planus. Simply having flat feet won't get you a rating. Do your feet and arches hurt? Do you wear inserts? Have you even gotten prescribed inserts? Do you feel numbness and tingling when you walk? Do you walk with a limp? Do you have plantar fasciitis? Do you have a diagnosis for it? If you broke bones like I did, metatarsalgia, that has a diagnostic code. All these things have diagnoses and diagnostic codes. So you need to have these things, and this is the medical evidence piece. Again, this comes down to social and occupational impairment. If you have plantar fasciitis like I do, just sucking it up like I did for a long time, drinking a lot, whatever, for 20 years. Like I didn't know I could complain about it, so I just dealt with it. So this is the time to complain about it, because this is where your compensation is going to come out of. Severity of symptoms, how much it affects your social and your work life. So she wraps up saying she couldn't stand seeing so many of her fellow veterans so distraught and being denied much of their claimed conditions, despite being, deployed, blown up several times, and genuinely 100% deserving of VA treatment and compensation for sacrificing their health and, serving their
Absolutely
country.
nothing.
That's what this comes down to. You served your country. You did it. You sucked it up. You didn't complain about it. Now it's time to complain about it. She is an example of a good CNP examiner, and you're going to encounter these. My last two CNP exams were good. I got a fair shake, I thought, at my CNP exams. But be prepared, and even a good CNP examiner, they need to hear these keywords, these phrases. They're checking boxes. So you need to study up on your disability and what your CNP exam is going to be like. This is why we have CNP exam prep. It sounds kind of silly and simple, but this is what it's all about. CNP exam prep is preparing yourself for your CNP exam, and we're just focusing in on the disability that you filed a claim for. And hopefully you don't take somebody's advice and file like 15 disabilities at once. You're going to get all sorts of CNP exams launched, and it's confusing. It's hard to keep track of. So don't do that if you're about to. The last part is, if you're about to get off active duty, don't wait. Get in now and start being seen and complain about everything. Make sure your mental health is checked out, your gut, your IBS, your feet, every orthopedic thing in your body. Check out your feet, x-rays, MRIs, CT scans, whatever you can get. Make sure you're checked out from head to toe, so when you actually get out and you become a veteran, that's when you can file a VA claim. And you're going to have a much easier time when you file a claim and it's been 3 months since you got out versus what I did. Filed my first claim 15 years after I got out, finally figured out how to file a claim, and ended up getting 100% P&T as a result on year 28. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.